Louis Children's Hospital as well. I have flown in the adult arena the entire time in the private sector for No-Trans Corporation, and then have been lucky enough to fly here in Monroe County for the last almost 5 years. So to get into flight nursing, it actually requires a pretty significant amount of not only certifications, but training. So this is not something that you just decide one day, oh, that looks pretty cool, I think I want to be a flight nurse. A special kind of nurse, first of all, meaning that you can function very autonomously. Keep in mind that when we're in the hospital nursing, we have a lot of support around us, right? If something happens in our room, we push a little button on the wall and people come running to help us. Or there's a lot of people to bounce questions off of. They just say, hey, what do you think about this? I have this situation going on with my patient. What would you do? What would be your idea to help in it? In the helicopter, it's you and your partner. That's it. There's no phone a friend. There's no button on the wall. It's you as the nurse being the highest level of care making that decision for the patient. So it can be a big problem if you don't have that knowledge base to draw from to make those appropriate decisions for the patient. It is a super cool job. So not gonna lie, it is cool. But it does take a lot of work. It's not that you're gonna graduate nursing school and work a year in a med-surg floor and then jump on the back of a helicopter. It doesn't work that way. The Nomex flight suit, which is mandatory to wear, so it's fire retardant, long sleeves to cover your arms. This is only going to give you about 8 to 10 seconds of fire protection, the whole suit, but hopefully long enough for you to either get the fire extinguisher, get out, jump into water, or kind of get it off of you. We're required to wear cotton only underneath the flight suit, nothing with elastic because elastic can burn. Our undergarments have to be nothing with elastic. The fire can melt it and burn you even more. I mean, the minimum in most programs is 3 years of ICU experience. Here we require 5. So 5 years of ICU experience and not ICU experience in the rural hospital. We want ICU experience in the Ryder Trauma Center, where you're seeing a lot of hardcore, very sick patients that on multiple drips that are intubated, ventilators. We don't carry a respiratory therapist with us. It's you. Right. It's the nurse that's managing the ventilator, titrating the drips, deciding halfway en route that the drip that they're on isn't doing it. We need to add an additional drip. You're choosing which drip that is. You don't have a doctor to call and say, so, which pressor should I add? No, it's you making that decision. We have to wear steel-toed boots because you have to see with the helicopter we're constantly we're backing this up and rolling over and out of the helicopter on scenes with rescues and rolling stretchers over, so you have to have your feet protected. We want you to have the ACLS experience, the PALS, the stable cards, the TNCCs, those classes that give you at least a background that you've been exposed, so that we know when you get in the back of this helicopter here and you have 1 hour flight from Lower Keys to Miami, that you're able to handle all kinds of situations on your own. All our nurses here on this aircraft are also paramedic. We all go to EMT school and then we all challenge the paramedic exam, because not only do we serve the nursing role, because we do a lot of inter-facility transports, as you know, we do a lot of field calls that we're landing on the sides of the bridges and the schools and picking up patients from the field that have been hit by cars, bitten by sharks. Have to also assist the paramedics in intubating. We're reading 12 leads. We're doing a lot of things that will be more paramedic driven than nurse driven. So it's very important that we have that skill set as well. Everybody's different, kind of what they carry in their pockets. Raptors, which are the shears that have a lot of different things on them to do, which is glass cutters, seatbelt cutters. These things can cut through anything. They have this is a glass punch for the windshield. So all kind of a key to get in the O2 tank. Always have hemostats to clamp ET tubes when you're going to be changing them over from the vent. There's probably only 2 programs in the country that actually utilize NPs in flight. I'm not utilized as an NP in this program. I'm flying as an RN here, and I'm flying as an RN at Children's. It's kind of overkill to have an NP in flight because all the procedures that I do that are done in flight can be done by an RN. Putting in a chest tube to be drilling for an interosseous line, to be needle decompressing, to be intubating. Those can all be done under the scope of our practice as an RN. So most of my nurses have a combination of experience, a couple years in an ER and a couple years in an ICU, and that's really the gold standard. And that makes you a great candidate to be in the back of this helicopter. You would get hired on as a float flight RN, and basically you would just go to whichever one of their bases needed fill-in help. They have bases all over the country, and they just fly you. 1 week you can be in Idaho, 1 week you could, be in Kansas, 1 week you could be in Oregon, Florida, Alabama. So just wherever you need help, so you could be a floater. So Mike is going through right now. You can see how kind of cramped it is in here. So the helicopter will carry 2 patients. This sled kind of slides over, and we have a secondary sled that slides in, so we can carry 2 patients at a time. So Mike is going through. We have a jump bag that's down there in the bottom that we carry all our medications. He's going through the airway roll bag now, which has our intubation kit in it. We also have a video laryngoscopy, which is called our CMAC, so we can actually use video to intubate. And so this is what we use for intubation. Awesome. So you pretty much can't miss with this. This is what hospitals use. Additional medication, terbutaline. We carry TXA, so that's to help stop bleeding. In addition, that we give blood products. Solumedrol. That's flumazenol. So that's a reversal agent for overdose. So we have the cardiac medication that is a little bit more robust. Nicardipine, Levophed, Cardizem. So we do a lot of MAG. There's all kinds of stuff in here. Epis. Esmolol for AAAs, so all kinds of Labetalol, and then these are like our different fluids if we need to actually mix the drips. Our resuscitation meds, nitro sprays. Mike has a drawer on his side with all the CLS drugs on it, and my drawers here are all the trauma equipment in here. The Lucas, so the thumper, is behind my chair there. Let's see if I can move this out of the way. So if we have a patient that has already had cardiac arrest, they would be transferred with the CPR. Secondary life pack inside. I have a second patient. This monitor is kept in here. This is a Tempest monitor, which actually has Bluetooth capability, so we're able to information right to the hospital.
Oh, that's awesome.
We can actually, when we take it out and hook it to the patient, we can do video conferencing with the hospital. So if the patient's having a stroke, we're able to connect in with the hospital, and the doctor can actually see the patient and see what's going on. That's pretty cool.
Do you frequently have the same flight nurse, flight medic duo, or do you have to swap out partners pretty frequently?
We swap out partners pretty frequently, only because the nurses work a different schedule than the medics. The medics are on a typical fire schedule, which is 24 on, 48 off, and the nurses are on a 48 on, 120 off. So 2 days on, 5 days off. If we're not on a call, once our operational duties are done, so meaning we do this in the morning, check out the helicopter, we have ordering and inventory responsibilities. We have a blood refrigerator because we carry blood, so we do our blood checkouts in the morning. Once our operational is done, then we're expected to PT, which is workout, and shower. We have educational expectations, so we do online education. Once that is all complete, then the time is ours. So it's very important in aviation. There's this thing called CRM, which is crew resource management, and just culture, which basically states that you need to be mission ready. Rest is super important. I work for the cardiac surgeon as NPs for him. We rotate in the ICU, so I care for patients directly in the cardiac ICU. So managing drips, ventilators. I'm doing procedures, putting in chest tubes, lines, suturing. I work in the OR as a first assist. If I rotate through the office, I'm doing all the pre-op teaching, consenting. If I work, I'm covering ER call. All the patients that are, presenting to the ER with cardiac problems, I'm doing all, the triage testing, echoes, EKGs, kind of like sorting out what's going on with those patients. So they have a pretty widespread role as NPs with the cardiac surgeon. Run a mile for time. You have to be able to swim 200 yards, and then you have to be able to tread water for 10 minutes, and you have to hold your breath for 30 seconds. And tower there at the Fire Academy, you have to be able to run up those stairs. It's 4 stories, so you run up the 8 stories total, so up and down twice with an 80-pound pack for time. And so that's pretty much what we train to. So we usually just do circuits with stairs, running, with the packs on. And so the boys work out every day here at the station, so we do the same thing with them. You need to be fit as well, because if you are physically exhausted with this job, trying to do this job, your mind soon follows. You have to be mentally fit and physically fit, because there's days that we fly back to back to back to back, and there's no rest. You have to be able to tolerate it both physically and mentally, so you have got to stay fit. And it's, I'm not gonna lie, sometimes there's days you're like, oh my God, will they just stop? But that's what we're here for, right? Someone that knows your limitations and understands that this field, no matter, again, I've been doing this 33 years, and there's not a day that goes by that I don't learn something new. And the day that you think you know everything is the day that you need to stop, because that's the day you become dangerous. Right? This is a field that things, are constantly evolving, and that's what actually makes it fun, right? Because there's never going to be a day that you know everything.
Thank you so much for talking to me. Do you have any other just advice for the students?
Just, if this is what you want to do, stay the course. It's tough, and I know some people think it's not glamorous to be in the ICU. They want to be in the ER because that's the cool thing to do. Hang on the course, get the job in the ICU, work hard, and learn everything you can. Just be a sponge, and you'll get here, and it's worth the ride.